Good day, everyone. Today, we will discuss the guidelines for standard precautions. These are the minimum infection prevention practices we must consistently apply in all patient care settings to protect both our patients and healthcare workers. By the end of this session, participants should be able to clearly define isolation precautions, distinguish between standard and transmission-based precautions, and identify the essential practices under each. Most importantly, we aim to highlight why strict and consistent compliance is necessary for both patient safety and healthcare worker protection. Isolation precautions are infection prevention practices designed to reduce the spread of infectious agents within healthcare settings. They are divided into two categories. First, standard precautions, which are applied universally to all patients, regardless of infection status. Second, transmission-based precautions, which are additional measures used when patients are suspected or confirmed to have specific infections that require extra protection, such as contact, droplet, or airborne precautions. Together, these measures form a strong barrier against healthcare-associated infections. Standard precautions are the foundation of infection prevention. They are applied to every patient, regardless of whether an infection is suspected or confirmed. These practices are risk-based and include measures such as hand hygiene, PPE, respiratory etiquette, patient placement, and environmental cleaning. Hand hygiene is the single most important measure to prevent infection. Wash with soap and water if visibly soiled. Otherwise, alcohol-based rubs are preferred. Always perform hand hygiene before and after patient contact, after fluid exposure, and after glove removal. PPE acts as a barrier between you and infectious material. Gloves must be changed between tasks, gowns protect your clothing, and eye or face protection should be used if splashes are possible. Always remove PPE safely and perform hand hygiene afterwards. Respiratory hygiene and cough etiquette are essential in preventing droplet transmission. Always cover your mouth and nose. Dispose of tissues immediately and post reminders in common areas. Patients who pose a transmission risk should be placed in single rooms whenever possible. If resources are limited, cohorting patients with the same infection may be allowed, but always assess the route of transmission and vulnerability of other patients. Patient care equipment and the environment are frequent sources of infection. Always clean instruments before disinfection or sterilization. High-touch areas like bed rails and tables should be disinfected more often than low-touch surfaces. When handling soiled linens, minimize shaking to avoid spreading contaminants. Always follow hospital guidelines for laundry and waste segregation. Safe injection practices are non-negotiable. Never reuse syringes or needles. Single-dose vials are best, but if multi-dose vials are used, a sterile needle and syringe are required for each access. For invasive procedures such as lumbar puncture, a surgical mask is mandatory to prevent droplet contamination. This is a critical safeguard for patient safety. Transmission-based precautions are special infection control measures used when patients have infections that require more than just standard precautions. They are necessary for highly transmissible or epidemiologically important pathogens. In immunosuppressed patients, these may be extended due to prolonged viral shedding. There are three main categories: contact, droplet, and airborne. Contact precautions protect against organisms spread by touch, either direct patient contact or contaminated surfaces. Examples include multi-drug-resistant organisms or patients with draining abscesses or diarrhea. Single rooms are preferred, but if not available, maintain at least 1 meter of separation and avoid immunocompromised roommates. Always use gloves and gowns before entry, and ensure equipment is either dedicated or disinfected before reuse. Droplet precautions prevent spread of infections like influenza, pertussis, or meningococcal meningitis. Droplets usually travel only about 1 meter. Place patients in single rooms when possible, or cohort them with others who have the same infection. Healthcare workers should wear a surgical mask when entering the patient's area and add gloves, gown, or eye protection if exposure to secretions is likely. During transport, patients should wear a surgical mask and observe cough etiquette. Airborne precautions are for infections that spread through very fine particles that can remain suspended in the air, such as tuberculosis, measles, and varicella. Patients should be placed in an airborne infection isolation room, ideally with negative pressure ventilation. If not available, use well-ventilated single rooms with natural or mechanical airflow strategies. Healthcare workers must wear a fit-tested N95 respirator or equivalent, and patients should wear a surgical mask during necessary transport. Transmission-based precautions remain in place for as long as the patient is infectious. The duration depends on the natural history of the disease. For some infections, like RSV or diphtheria, lab confirmation is needed before discontinuation. Always consult institutional IPC guidelines before lifting precautions. To summarize, isolation precautions consist of standard precautions and transmission-based precautions. Standard precautions must be practiced with every patient, every time, and include essentials like hand hygiene, PP, and safe injection practices. Transmission-based precautions are added for patients with known or suspected infections, and these are tailored to whether the pathogen spreads by contact, droplets, or airborne routes. The overall goal is to protect both our patients and our healthcare workers while preventing healthcare-associated infections. Consistency, vigilance, and adherence to these precautions are the keys to keeping Ospital in Makati a safe environment for care.